Without further ado, we will now proceed our first panel session, Why Islamic Psychology? This session will feature three speakers, Dr. Bagus Riono, Dr. Hanan, and Professor Dr. Gulam Hussein Rasul.
I would like to give the first term to Dr. Hanan. I would like to introduce a bit, even though maybe everyone already know her. She is famous. Yeah. So Dr. Hanan is a clinical and forensic psychologist and psychotherapist and lecturer at Charles Sturt University, Australia. So she is initiating Islamic psychology course, the first Islamic psychology course in Global South, I think, yeah, in the world, yeah. And she and her colleague have established a graduate program in Islamic psychology that has become one of the certificate graduate program within Charles Sturt University. She specialized in mental health within Islamic communities. Her research addresses rehabilitation and the integration of Islamic psychological practice in clinical setting. And for your information, she runs also a counseling therapy in Australia and has so many clients. So we will learn from her extensive clinical experience. So please, Dr. Hanan, the floor is yours. I think you have like about 25 minutes.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم السلام عليكم ورحمة الله وبركاته. I'd like to give gratitude initially to UGM, IAMP and IIIT for collaboratively hosting this very important event. It's the first Islamic Psychology Summit. And I think that, inshallah, good things come from this summit because we really need to further the discipline of Islamic psychology, which is why I'm presenting the topic today. But before I do, I'd like to give gratitude to the late Professor Malik Badri. May Allah subhanahu wa ta'ala illuminate his grave. And also Dr. Amber Haq, who shaped my journey in Islamic psychology. And it was in this venue, in this university in 2016, when Professor Malik Badri, when he introduced me as the jihadi psychologist. And I appreciate that title. And in relation to the earlier speakers about, the genocide and, psychology, and I do believe, and very strongly, that it's not necessarily that psychology has the answer. The Quran has the answer, and the Quran has actually made jihad compulsory on our ummah. So my topic is on the community perceptions and expectations of Islamic counseling and Islamic psychology practitioners. I do accept that we've done a very good start in looking at Islamic psychology emerging as a discipline. It started with Professor Malik Badri and many other academics and scholars that are here today who have tried to further the discipline. But one of the issues that we're facing is that individuals or practitioners or groups who may be calling themselves Islamic counselors, Islamic psychologists, without the necessary scholarly, academic and accreditations that we may have to consider before we have future issues in our hands. Islamic counseling and Islamic psychology, they are therapeutic approaches that integrate Islamic principles and also Islamic counseling. And Islamic counseling is a method of addressing the emotional, mental, and spiritual issues through frameworks grounded in Islamic teachings in the Quran and Sunnah. It emphasizes the connection between mental well-being and spiritual growth that guides individuals to balance their life in a mizan, reconciling psychological principles with their faith and also with their religious identity. Islamic psychology, on the other hand, is a broader field that encompasses the deeper theoretical models and practical interventions aiming to understand human behavior and cognitions within the lens of Islamic epistemology. So it draws on the concepts such as nafs and fitra and tawakkul, and it presents a holistic understanding of human behavior. and we diagnose as well. So in Islamic psychology, for psychologists, we also go through the more academic, and practical process of diagnosing as well. And that considers a lot of the cognitive and emotional processes, but also the spiritual and ethical dimensions of the human self. This is what differs from Western psychology. So and we know across the world, especially with the emergence of the different Islamic counseling and Islamic psychological courses, that there is a demand for culturally congruent health practitioners. We want practitioners who align with our values. So we have Muslim clients now who expect that there are Muslim counselors available, Muslim psychologists available, Muslim psychiatrists available, Muslim psychotherapists available as well. So given this trend, there is going to be, this trend exists because there are several factors. There's mental health stigma and misalignment. So traditional mental health models, they fail to resonate with Muslims due to the limited consideration for our spiritual and also cultural factors. We also may feel misunderstood when we access conventional therapists and also mainstream services, because they lack Islamic knowledge and knowledge about our beliefs and cultural practices as well. And so this is where the Islamic counseling and Islamic psychology addresses this gap by offering a culturally and spiritually familiar framework to Muslim clients. So, and that makes healthcare, mental health care, more accessible and less stigmatizing for Muslims. There's a growing Muslim population, so that needs to parallel with extra mental health services. And this is evident in multicultural societies in the West, but also Muslim majority countries. Okay, before, when our Muslim majority countries were a bit more secular in the academic institutions, we have very strong jihadi academics who are trying to push through Islamic psychology, and it's a very difficult task. SubhanAllah, in Australia, it wasn't difficult. I don't know why. Allah subhanahu wa ta'ala made the facilitation easy because Islamic psychology is actually taught at a secular university. But Australia has always been warm to different approaches and different ideas. And it's interesting because there's a lot more hurdles and challenges trying to get through Islamic psychology within Islamic institutions without them having the secular psychology, and you just add on Islamic psychology. We need an Islamic psychology that has its foundations within the Quran and Sunnah and ethical frameworks and values of Islam. So, and there are, for example, improved awareness and education on the internet. It has its good and its bad. One of its good is the increasing awareness of Islamic psychology. And there's also a lot of trauma and socio-political factors. So we often face challenges around the world, discrimination, Islamophobia, and conflict-related trauma that increases the need for culturally relevant mental health support. For example, I'm from Australia, so the mainstream services cannot deal with the current situation where the Muslim Ummah in Australia is being vicariously traumatized by the genocide in Palestine, and it's been extended into Lebanon, especially when the government is a friend of Israel. So, and there is an expectation by the community, okay, that there should be an element of trust within the discipline. There's a perception that Muslim psychologists or Islamic counselors are pioneers who have integrated Islamic teachings authentically and not superficially. But we don't have any safeguards at the moment. I will talk about organizations that do exist who are trying to minimize this and minimize the issue and address the issue, and also to address the diluted or misinterpreted Islamic concepts that practitioners may be claiming to use without proper training and Islamic credentials. So not only do they expect us to be authentic in our approach in terms of delivering a mental health service that's for Muslims and the integration of the Islamic knowledge, but we need to be able to explain important Islamic concepts and have a comprehensive understanding of these concepts, epistemology, ethics, and also spiritual principles. Okay, and one of the issues is that we have a lot of unqualified practitioners. there are a lot of practitioners who claim they do Islamic counseling or Islamic psychology, as practitioners, and they can be the self-taught counselors. The trained professionals are the qualified counselors in their respective countries, within their formal body and licensing registrations. They possess formal education in both psychology and also potentially Islamic studies. They undergo accredited training programs. They adhere to ethical guidelines and often maintain membership with professional bodies. And these practitioners integrate the Islamic concepts into their therapeutic practice based on sound scholarship and clinical expertise. The self-taught counselors who are able to call themselves counselors because the word counseling may not be a regulated profession or licensing body that would accredit counselors. And I expressed my concern a few times to our board members with IAMP, that there's a lot of free programs in Islamic psychology, and when you do a lot of these free programs, some people believe that they have the free license to then call themselves Islamic psychologists, Muslim psychologists, or Muslim psychological practitioners, Islamic, counselors, using different terminology to make themselves credible. And this is a concern. It's a concern because there's a higher risk. In Australia, people see me as elitist for suggesting we need to be accredited, in this space, but it's to safeguard our ummah at the end of the day, I mean, we don't have a problem in the medical profession because no one will call themselves a doctor unless they've got a medical degree. But when it comes to counseling, there's more blurred lines and more boundary breaking as well. For example, a self-taught counselor may attribute a client's depression solely to spiritual weakness without looking at clinical factors, or chemical issues, trauma, environmental stresses, whereas we have an in-depth approach of how we do a clinical assessment and intervention. A self-taught counselor will not do this, and may resort to very basic understanding and may cause harm to the client. So these inappropriate interventions, there are no safeguards as well. Who's going to regulate these practitioners? We don't have a regulatory body, that's going to protect individuals who expect an authentic accredited counselor. We don't have this in place. And this can result in, clients being more anxious, re-traumatized and so forth. And also opens the door for spiritual abuse as well. So unqualified practitioners may use Islamic concepts to manipulate clients to enforce compliance. For example, a woman who's experiencing domestic violence may be encouraged to return to her husband, especially if there's severe danger and abuse involved, insisting that she just should use tawakkul and rely on Allah subhanahu wa ta'ala. He shall, take care of affairs because Sitna Asya, she was patient with Pharaoh. Okay, this is very, very, very dangerous. So it impacts on our communities quite widely. It increases confusion and mistrust. So clients may struggle to distinguish between the qualified counselors with no formal training, resulting in diminished distrust in us as a whole, as a profession. So we need to step up, and have a larger presence, to our ummah who are, for the most part, on the internet, to let them know the difference between, who is a qualified practitioner and who is not. There are countries who have their own Islamic psychology kind of chapters within universities or groups. There are also two main associations. You've got these IAMP, the International Association of Muslim Psychologists, and you've also got the International Association of Islamic Psychology, who can take some leadership on this particular issue as well. So there needs to be the need for accreditation and regulation to mitigate these risks. Okay, so we need to look at, and I'm talking about psychology here, not necessarily their basic counseling, but the psychological science. Okay, so to establish clear boundaries for training, ethical guidelines, and proper integration of Islamic teachings into therapeutic practices, accreditation bodies should require counselors to have formal education in both psychology, potentially Islamic studies, ensuring that they are equipped to provide accurate, effective, and ethical interventions. I know that Professor Rasul has always advocated Islamic studies should be part and parcel of being a practitioner in Islamic psychology, same with the Khalil Center and others as well. And education to the community is actually essential. So maybe practitioners should be, accredited in their local psychology boards or institutions, and this ensures a standard. And this is actually very important, because every country will have a different standard. We may not have one overall international standard because it may not be suitable for people from different countries. Okay, and after they do get accreditation, they can do specialized training in Islamic psychology, and there are various institutions, and I've got time to name them. I've only done 11 minutes. I'm doing well. Okay, fair, inshallah. Okay, all right. So they can do additional training, online courses, workshops, and supervised clinical practice to tailor their work with Islamic principles. This is very important, and the focus will be integrating Islamic teachings with psychological skills. Okay, and this is not discounting the work of secular psychology. Secular psychology, a lot of the principles and methods do have a space in the Islamic framework of Islamic psychology. Anything that does go against Quran and Sunnah, we don't have to adopt, or actually we shouldn't adopt. So big no-no. But because the Western psychology has done a lot of research into strategies and modalities and skills-based efforts in psychology, we need to be able to utilize them. We do know that early Muslim scholars did have very useful strategies when it came to mental health and addressing mental illness, and these are taught in Islamic psychology courses like CBT, cognitive behavioral therapy. Western psychology has taken the prominence that they devised CBT, but we know, for example, early classical Islamic scholars had already introduced CBT without calling it cognitive behavioral therapy. We know Ibn al-Qayyim al-Jawziyah has a perfect model for CBT, for example. So it's about using their models and developing it rather than looking at, Western models, which are good, but we want to be able to make our Islamic early scholars more prominent and do research according to their models. And so this two-tiered approach ensures that practitioners are locally recognized and capable of integrating Islamic principles. So wherever they're working within their region or country or locality, they are well equipped with dealing Muslims within their areas. So there are current existing frameworks where there's attempts to run programs, whether they're skills-based, whether they're theoretical-based, whether they're accreditation-based around the world. The one that I teach in Australia is the Graduate Certificate in Islamic Psychology. It is the first kind of program in Australia. It's the first accredited university program in the West. Okay, I don't know about Muslim majority nations, but it's accredited in the West. That's why we have international students who also register for the program. And that's designed to provide students with a comprehensive understanding of Islamic psychological principles integrated with contemporary psychology practices. And that's run by Charles Sturt University and also ISRA. Indonesia has a large Islamic psychology research network, and there's a lot more Muslim universities who are adopting Islamic psychology as within their courses having Islamic psychology subjects, or even having practical certification programs within or outside the university. And there's an attempt to integrate Maqasid al-Sharia as well. And also in the UK, there's Al-Balagh Academy, which is an independent organization trying to teach psychological principles within the Islamic framework as well. And there's Cambridge Muslim College that offer a diploma in Islamic psychology. In Pakistan, there is integration of Islamic psychology. Rifa University is trying to integrate Islamic psychology as well within the university programs. In India, there's the Indian Council on Islamic Psychology. There's the Brain and Mind Hospital. They're trying to integrate Islamic psychology into clinical practice. In Malaysia, at IIUM, everybody knows, in the International Islamic University of Malaysia, there's been frequent attempts to try and integrate the discipline. In Russia, we have Professor Olga, who's trying to integrate Islam and psychology. Turkey has private institutions or universities also trying to, Al-Zain University, Ibn Khaldun University. Sudan, the pioneer, of modern psychology, the late Professor Malik Badri, Al-Nilain University, the other universities are trying to integrate Islam and psychology. United States, there is the Khalil Center, which is a school of Islamic psychology, and also Stanford University Lab as well. I apologize if I haven't mentioned, other nation states or places, but it's the area or the discipline of Islamic psychology is growing, and it's generalizing into psychological practice. And given there's an increased number of clinicians, okay, we need to be able to, even though we're developing all those Islamic psychology models, okay, we need to do more about the clinical application of Islamic psychology. I know when I started learning about Islamic psychology through respected academics, it was very, very, very theoretical. It wasn't until Professor Rasul, his textbooks have a lot of clinical applications. The International Association of Islamic Psychology also trying to put out clinical applications in Islamic psychology. The Khalil Center as well has the Integrated Islamic Psychotherapy textbook. So there are moves to make, Islamic psychology more of a clinically applied approach. But what we do need to make sure is that, again, it's more regulated, where individuals who study basic training that's available on the internet, that's not accredited, do not, take on the clinical practice and deliver more than what they should be delivering. So one of the things that IAMP is looking at, because we realize this concern, so we're trying to develop a task force, is looking at a code of ethics. I think a code of ethics is very important, because we know in our respective countries, in our psychology societies, for example, the Australian Psychology Society or the regulatory body called APRA in Australia, we have a code of ethics for psychologists that we need to abide by. And if we don't abide by them, we risk losing our registration. Okay, because we have to, as much as we can, reduce harm, because we're trying to promote overall mental wellness and psychological health of our clients. So we need to protect clients. We need to uphold Islamic values. We need to maintain professional standards. We need to build credibility within our discipline, and we need to guide ethical decision-making. So introducing a comprehensive code of ethics should be at the forefront, because when someone asks, okay, what is Islamic psychology? What is it how do we adopt that as a clinician? What do I need to ensure I do or not do? Okay, so we need to develop a comprehensive framework where it aligns with both the psychological ethics, for example, confidentiality, competency, informed consent, Islamic ethical principles like adl, justice, ihsan, taqwa, and integrating the code is culturally and spiritually relevant for Muslims. We need to collaborate amongst institutions. Okay, so there's a consistency and we align within those values, when it comes to a code of ethics. If I can focus on the International Association of Muslim Psychologists, and there's also the International Association of Islamic Psychology, we should be looking in, at least at the international scale, looking at building this. So we need to look at, for example, partnerships, not just with academic institutions, but institutions that are providing clinical practice, education and training. So incorporating ethical training into the Islamic psychology programs. So having applied types of training, we should have ethical review boards as well, specific to Islamic psychology, where practitioners can consult on complex cases, ensuring adherence to both psychological and Islamic ethics, and having regular updates as well. Okay, so when we have a code of ethics, their standards and they are upheld, and we can effectively integrate our ethics within Islamic psychology practice, this will increase the Ummah's confidence in delivering such a service. And strengthening trust and enhancing credibility in Islamic psychology requires a multifaceted approach that includes clear accreditation, effective community education, because we're still young, we're still small, and culturally aligned training programs and a code of ethics. And I know that all of this requires funding. Okay, so I don't know who's going to be able to fund all of this, but, it does require funding because we're all busy in our respective professions, but we need to have a team, a task force to look at this. And this is important for us to build confidence, because I've seen over the years, people join organizations and they get busy and they leave, and then we fall short, so we need to have a task force that is dedicated, to the operations of these accrediting bodies. And by addressing these areas, the field of Islamic psychology can ensure ethical, competent, and effective mental health care that aligns with Islamic principles and meets the needs of Muslim communities. And so collaborative efforts, I'm stressing the word collaborative, nobody can do this on their own. Okay, so we need to have a task force, amongst accreditation bodies, and they need to be aligned with academic institutions. We can't do this as private organizations, really, we can't. It needs to be attached. Like when I've been looking at different universities in the last over 20 years, I truly believe, and please, I'm strong, so you can't hurt me. I truly believe Indonesia is the home of Islamic psychology because it's got the largest Muslim population, and a lot of the universities I've noticed are trying to bridge Islam and psychology, because a lot of us who are attached to institutions have left institutions and become private practitioners, and then whatever we try to develop falls, but yeah, that's why it's important to be attached to academic institution. And I didn't say this because I'm in Indonesia, just my observation. So I didn't do research, but observation. So collaborative efforts amongst accreditation bodies, academic institutions, community organizations, training institutions, even thought centers like IIIT, who have over the years emphasized the importance of Islamic psychology. My time is up. So Jazakallah khairan. I do wish that we achieve this with the support of everybody. Jazakallah khairan. Assalamu alaikum.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Sister Hanan. I think we can reflect that the speech from Sister Hanan with our various health system, because we can feel that Sister Hanan came from the very developed, well-developed health system, So then I think we can have a very various discussion about that.